With just 3 minutes every night without needing any medication or visiting a doctor, you can soothe your lingering back pain, knee pain, and joint discomfort all by yourself. If there was a simple way like that, would you be willing to give it a try? In this video, I will reveal to you a magical area on your body just by massaging 3 specific points. Layer by layer, the pain will start to melt away. And what is even more fascinating, these points are not actually located where you feel the pain, which is a common misconception for so many people. Before we dive in, go ahead and leave a comment below with a positive affirmation as a way to commit yourself and attract good things into your life. Something like, "I am healing my body every day," or whatever intention you would like to send out. And do not forget to hit the like button, subscribe to the channel, and turn on the notification bell so you will not miss out on more wonderful health tips like this one. Let us build a community full of positive energy and vibrant health together. Are you ready to discover the 3-minute nightly secret to blowing away your pain? Keep watching, because what is coming up next will absolutely surprise you. Now, why can just a few minutes of proper massage bring such a big transformation to our bodies? To really understand, let us dig a little deeper. As we get older, blood circulation in the body gradually decreases. Our muscles lose elasticity and start to shrink. The joints, which once moved smoothly and easily, begin to wear down, stiffen, and become prone to inflammation and pain. That is why our steps feel heavier, our backs ache, and our knees crack and pop every morning when we get out of bed. However, one of the most common mistakes people make is accepting this pain as inevitable or becoming entirely dependent on painkillers. This approach is like muffling the sound of a fire alarm without actually putting out the fire smoldering inside the body. The good news is, we can absolutely take control. With just 3 minutes of the right kind of massage, you can dramatically boost blood circulation, relax tight muscle groups, and activate the body's natural anti-inflammatory mechanisms. Even better, you do not need medication, expensive devices, or daily visits to a physical therapy clinic. Everything you need is right here in your own 2 hands. So which parts of the body need to be awakened? Let us dive in right now. 1. The soles of the feet. It may sound simple, but the soles of the feet are like a major transfer station for the entire body. In both traditional Eastern medicine and modern neuroscience, the middle area of the sole, where the Yongquan point is located, is seen as a gateway that channels life energy and vitality. When this acupoint is activated correctly, it does not just have a local effect, it sends a ripple of benefits throughout the whole body. The spot you need to focus on is right in the center of the foot, extending down toward the heel. This area is packed with nerve endings, closely connected to internal organs and the circulatory system. When blood starts flowing more efficiently, the body naturally reduces inflammation, relaxes the muscles, and releases endorphins, our body's natural painkillers. A study from Harvard Medical School found that massaging the soles of the feet can stimulate the production of endorphins, those natural, happy molecules. Endorphins not only work like biological pain relievers, but they also uplift your mood, making it easier for you to drift into deep sleep and allow your body to recover in the most relaxed state. The method is extremely simple each night right before getting into bed. Spend about 1 to 2 minutes on each foot. Use your thumb to press gently into the center of the sole and make slow circular motions in a clockwise direction. If you want a deeper but still safe sensation, you can use a small soft ball like a tennis ball. Place it under your foot and gently roll it. The most important thing is to feel a warm, slightly tingling sensation spreading from the sole out toward your toes. As you massage, you will feel the change very clearly. Your whole body loosens up, and the pain in your back and knees seems to ease away. Many people who have practiced this consistently even report needing fewer sleeping pills or painkillers. This is nature's free gift to our bodies. No side effects, no costs, just a little patience and self-love. 2. The front of the thigh. If the soles of the feet are like a support system for circulation, Then the front of the thigh, where the quadriceps muscles are located, acts like anchors, stabilizing the entire pelvis and lower spine. The quadriceps are a large group of muscles covering the front of the thigh, stretching from the pelvis down to the kneecap. When you sit for long periods, move very little, or use poor posture, these muscles tend to tighten and shorten. As a result, they pull the pelvis forward, placing abnormal pressure on the lower spine. Because the thigh muscles attach directly to the kneecap, excessive tightness also misaligns the knee joint, leading to pain and early degeneration. The technique is very simple. Find the muscle group right at the front of your thigh, starting near the hip joint, and gently stroke downward toward just above the knee. Using your thumb or the palm of your hand, press lightly into different points along the muscle and make small, circular motions. If you find a slightly painful or tender spot that is a sign of muscle tension, be patient and gently massage that area. The feeling of slightly painful but pleasant is your signal that the muscle is starting to loosen up and blood flow is improving. You only need about 1 to 2 minutes on each thigh, but the key is consistent daily care. Do not wait until pain forces you to act, because the health of your muscles, bones, and joints is the result of quiet daily nurturing. Let me share a real story. A woman in her 70s whom I treated once struggled to walk and had to rely on a cane for support. After learning and practicing nightly massages on her thigh muscles within just 2 weeks, she was able to stand firmly and walk independently without her cane. She was moved to tears and said, "If you know how to love your legs, they will respond with a strength you never thought possible." Modern medicine also acknowledges that massaging the quadriceps can improve mobility, lower the risk of falls, and slow down the degeneration of knee joints, a major cause of losing independence in old age. 3. The area behind the knee. Right behind our knees at the crease that forms when we bend them, there lies an exceptionally sensitive area, a convergence point for many important meridians directly connected to the health of our back and knees. In Eastern medicine, this spot is often called the gateway point because it acts like a vital interchange, regulating the flow of energy from the lower body up through the spine. According to modern anatomy, the back of the knee houses a complex network of large blood vessels, nerves, and connective tissues. When this area becomes stagnant due to long periods of sitting low physical activity or natural aging, it disrupts blood flow and increases internal pressure within the knee and lower back. If this stagnation continues, it does not just cause discomfort, but can also lead to serious problems like knee arthritis, herniated discs, and even muscle atrophy in older adults. Proper stimulation of the back of the knee helps release these blockages. When you gently press your thumbs into the center of the knee crease about 5 to 7 times, you will feel a pleasant tingling sensation spreading out. This is a sign that the energy channels are starting to open, blood pressure in the vessels is being relieved, and pain in the lower back and knees is beginning to ease. I once witnessed a case where an elderly woman was advised by her doctor to prepare for knee replacement surgery due to severe pain and degeneration. However, after diligently massaging the area behind her knees each day and adjusting her movement habits within just 3 months, she not only avoided surgery, but was also able to confidently walk short distances without any support. This was not a miracle. It was the direct result of understanding and taking proper care of her body. 4. The lower back. We have already worked through key areas in the legs and thighs. Now it is time to move upward to the powerhouse of the body, the lower back, home to the erector spinae muscles. If you imagine the spine as the main pillar holding up the house of the body, then these muscles are like dynamic suspension cables that keep the whole structure stable, balanced, and strong. The lower back, especially the area along both sides of the spine, bears constant pressure from the body's weight and daily movements, like standing, sitting, bending, and twisting. Over time, especially as we age, the erector spinae muscles tend to tighten and stiffen, leading to reduced blood supply to the spine, causing persistent or even sharp lower back pain. This is the underlying cause of many cases of chronic back pain in elderly people, and if left unaddressed, it can develop into herniated discs or spinal degeneration. A very important note: you should not massage directly over the vertebrae themselves because the spine is sensitive and vulnerable, especially in older individuals. Instead, focus about 1 to 1.5 inches away from the spine, where the erector spinae muscle bundles run from the lower back up to the mid-back. The technique is easy. You can sit on a chair with back support or lie flat on a soft surface. Place your hands along both sides of your lower spine and use your fingertips or palms to gently make small circular motions or smooth strokes downward with moderate pressure. The goal is to feel a gradual warmth and softening of the muscles, along with a lightness, as if a heavy burden is being lifted off your back. By massaging this area regularly, you are helping to reopen long-blocked blood circulation channels and stimulate the production of nourishing fluids for the spinal discs, those crucial components that deteriorate the most with aging. Research from the University of California has shown that gentle lower back massage for just 2 to 3 minutes a day can improve spinal flexibility by up to 30% after 8 weeks, while significantly reducing chronic back pain without the need for painkillers, especially for older adults as spinal discs lose hydration and vertebrae compress. These simple massages become even more invaluable. They do not just offer temporary relief. They act as a life-sustaining care method for the spine, helping preserve mobility and independence while preventing serious complications like vertebral slippage, hunched back, or even paralysis. 5. The ankles. If the lower back is the pillar supporting the body, then the ankles are the foundation for balance and mobility throughout the entire musculoskeletal system. Despite their small size, the ankle joints bear the full weight of the body every day and play a crucial role in determining posture, balance, and the flexibility of the knees and hips. In clinical practice, many cases of chronic knee or hip pain can actually be traced back to a lack of flexibility in the ankles, something most people often overlook. When the ankles become stiff or weak, the body must compensate by altering posture, which misaligns the knee and hip joints, increasing strain and eventually causing chronic pain. Biomechanical studies have confirmed that blood circulation around the ankles plays a vital role. This area acts as a transfer station for blood returning from the legs to the heart, helping maintain continuous circulation throughout the whole system. When blood vessels around the ankles are compressed or circulation is poor, it can cause swelling and even increase the risk of deep vein thrombosis, a dangerous complication especially in the elderly. That is why gentle massage around the ankles, both the inner and outer sides, is not just about relaxation. It is a way to release blocked pathways, help blood return more easily to the heart, and maintain the flexibility essential for the neighboring joints. All you need to do is use your thumbs to gently make slow circular motions around the ankle. Move steadily and evenly, focusing on both the inner and outer sides of the ankle. For older adults or those experiencing swelling, be especially mindful to massage very gently without applying strong pressure to avoid damaging fragile blood vessels. These small movements, when done consistently each day, will significantly improve your body's balance and stability, helping to prevent falls, a major cause of fractures and loss of mobility in older adults. Additionally, restoring flexibility to the ankles naturally makes walking smoother and more stable, reducing the load on the knees and hips, which have already endured so much over the years. 6. The calves. When it comes to circulation and mobility in older adults, the calves are one of the most important pumping stations, yet often the most overlooked. The muscles behind the lower legs, the gastrocnemius and soleus muscles, not only support the body's weight while standing and walking, but also play a vital role in pushing blood back up from the legs to the heart. Physiologically, every time the calves contract, they create mechanical pressure on the deep veins, helping blood move against gravity back to the heart. However, with time and age, the natural pumping strength of the calves significantly decreases, especially in those who are less active, sit for long periods, or stand for extended hours. As a result, blood stagnates in the lower limbs, causing swelling, numbness, and increasing the risk of blood clots, a hidden threat to cardiovascular health. Massaging the calves daily helps reactivate this natural pumping function. Simple movements, like gently wrapping your hands around the calf and performing rhythmic squeezing and releasing help the blood vessels expand, reduce venous pressure, and enhance blood flow back to the heart. To further optimize this, you can also gently stroke upward from the ankle toward the calf to boost the reverse flow effect. It is important to remember that all movements should be performed with moderate pressure, only to the point where it feels comfortable. Pressing too hard can damage fragile capillaries, especially in older individuals with already delicate circulatory systems. Besides improving circulation, calf massage is a simple yet effective way to reduce the risk of nighttime leg cramps, a very common condition in seniors due to poor circulation and muscle ischemia. Keeping the calves flexible also helps to relieve pressure on the knee joints and enhances walking stability. Many physical therapy studies have shown that maintaining a daily calf care routine can significantly reduce the risk of falls in older adults and extend independent mobility for many more years. Massage is the subtle art of listening to the body. But for this small action to become a truly safe and effective therapy, you need to remember some fundamental principles. First and foremost, controlling hand pressure is critical. Always keep in mind, the goal is not to crush the pain, but to clear blockages and soothe the body. If you apply too much force, the soft tissues under the skin, which are already fragile with time, can get damaged, causing a counterproductive effect. Choose a moderate amount of pressure enough to feel the impact, but still keep it gentle and comfortable. A golden rule you should always remember: press only to the point of slight pain, but still comfortable. If you feel sharp pain or increased tension, that is a sign you have gone beyond the safe limit. Listen to your body's signals and adjust your hand pressure so that each movement brings deep relaxation rather than strain. For individuals living with specific health conditions, such as severe osteoporosis diabetes, that causes loss of sensation in the lower limbs or circulatory problems, even gentle massage should be done under medical advice. These conditions change the structure of muscles, blood flow, and nerve sensitivity, making self-massage riskier compared to healthy individuals. A short consultation with a doctor can provide peace of mind and ensure you are caring for your body properly. Besides technique, the timing of the massage also plays a crucial role in its effectiveness. The best time for a massage is after a warm bath, when blood vessels are naturally dilated, muscles are softened, and the nervous system is in a relaxed state. Taking advantage of this golden window will help you achieve maximum results with minimal effort. Also, during the massage, do not forget to pair it with deep breathing. Slow, deep breathing from the belly not only helps the body relax better, but also maximizes its ability to absorb the therapeutic effects. With each massage movement, take a deep breath. You will feel the difference. The body will loosen more easily. The mind will become calmer, and the recovery process will occur more naturally. Finally, always remember to massage both sides of the body evenly. Even if the pain seems more severe on one side, balanced care ensures that your overall mobility remains harmonious. Never neglect one side of the body because every detail is interconnected, and balance is the foundation for long-term health. At this point, you have simple yet powerful secrets in your hands to actively take care of your body every day. You might wonder, can just a few minutes of these small massage moves really make a big difference? The answer is yes, and that transformation begins the very moment you decide to act. Good health in old age does not happen by accident. It is the result of countless small choices accumulated persistently day after day. Just 3 minutes spent for yourself each day are like quietly laying down bricks for a future filled with strength, freedom, and joy. Before you leave, I have a small invitation for you. Leave a positive affirmation in the comments section below as a commitment to your new journey. For example, I cherish my body and am rejuvenating every day, or any wish that resonates from your heart. And do not forget, if you found this video helpful, please click like, subscribe to the channel, and turn on the notification bell. Doing so will not only help you stay connected with more valuable content, but will also help us build a vibrant and positive community where everyone is inspired to live healthy, joyful, and free at any age. Wishing you more flexibility, more peace, and endless happiness each day. See you again on our next wonderful journey.